Hello, I'm Dr. David Tullos. I want to talk to you today about migraine headaches. Over the 27 years of my practice here at Jackson, I've seen hundreds, probably thousands, of migraine headaches. And I want you to know if you're suffering from migraine or headaches in general, I can probably help you. There is hope. There are many reasons people come to our office to get relief of headaches. A lot of times it happens from a slip or a fall, sports injuries, car accidents. It can even be sleeping on a pillow that's too tall for your neck. One of the things we look at, and we do a real comprehensive orthopedic and neurological examination to see what is causing the symptoms of headaches. One of the things we look at, and we find often in thousands of patients, this is a spine, and the neck curve, this is the cervical curve in the neck, should be curved forward like this as to support the weight of the head that weighs 8 to 12 pounds. If the neck is like this in a normal cervical C curve like this, the neck can act like a shock absorber on the head. A decreased cervical curve can cause pressure on the nerves that exit the spinal column and pressure on the brainstem and the vertebral arteries, which supply the brain with blood and nerve supply. It doesn't take much pressure on the nerves to cause over 50% loss of the nerve and blood supply to the brain, which can contribute to migraine headaches. Let me show you an x-ray of a normal curve and a curve that is decreased. And in this patient, they had pressure on the spinal nerves and had a lot of headaches and general headaches, and we were able to help this patient. On this x-ray on the top here is a normal cervical curve, and you can kind of see how that curve, the red line shows a normal curve. It supports the weight of the head. And on this bottom x-ray, the neck is real straight. So instead of having a C curve in the front, it has a straight curve and it has no curve to it. So that all the pressure and the weight of the head is coming down on the nerves that exit the spinal column. And as I stated earlier, this can cause headaches. We have great results in treating headaches and migraines. Let me tell you, we will look at all your past medical records, and we will work with your medical doctor to make sure that there's not a pathology. Most patients that come to our office have already had an MRI or a CAT scan that has migraine headaches. So we will work hand in hand with your medical doctor to try to eliminate the cause of these x-rays. This reminds me of a story of a patient I had that came in a few years ago that had severe migraines. She was actually referred to me by her medical doctor. She had migraines for 5 years. She talked about she couldn't go to school events of her kids. She wasn't a very good wife because she was always in a bad mood. She said when her head was hurting, she'd have to go to a dark room sometimes for 2 or 3 days. She had tried 6 to 10 different medications that only temporarily gave her relief. She was tired of it, so she was referred here, and we did a thorough examination and found out in her case, like the x-ray I showed you earlier, she had some pinched nerves in her neck that was causing decreased nerve and blood flow to the brain. We did a very thorough examination and gave her a treatment plan that was selected just for her and what was going on in her body. It included spinal manipulations, some exercise, some of the things she did at home, some that she did here with therapeutic modalities. But she came back after 2 to 3 weeks and was feeling so much better, and she actually wrote me a testimonial that I have in my office. She was so excited. She was like, hey, you gave me my life back. For that, I gave God the credit, because we just make the body work the way that He made it after we abuse it or we're in accidents or whatever the cause of the problem may be. But she said she was able to not miss work anymore. She was able to go to her kids' activities and sports and church things that she had. She and her husband even went on a camping trip that she had never been able to go with before. She was very emotional, but it changed her life. And that's what we'd like to do for any of you that have migraines or tension headaches. So if you or someone you know suffer from headaches, please call our office directly at 601-981-2273 or punch the button below and someone from our team will call you for an appointment. We look forward to helping you. God bless.